we were thinking, especially with all this talk about manual lymphatic drainage, and we've been sitting here for the past hour together, we might need to move our lymph a little bit. And we were thinking about doing a little lymph drainage warm up with our lovely Karen Ashforth. The obvious caveat is that MLD is a medical treatment and it's customized to the individual patient by the lymphedema therapist. So what Karen's going to show us is just some of the core clearing techniques that's common to all people with swelling. So just sort of the general MLD kind of stuff that you do maybe before you'd pump or do the full MLD treatment. So if you all would like to do a group sesh together at the hands of our lovely Karen, we were thinking that might be a fun thing to try.
Well, thank you. So I'm going to teach you what I teach all my lymphedema patients on the very first visit. And this is also what I teach all of my patients who use a pump, because a lot of people think, oh, a pump is going to do all the work. And no, we need to really prime the pump and get the whole lymphatic system moving. So we're going to start up at the neck. And I want you to put your hands on your collarbones. Find your collarbones and then just go slightly above. I want you to use a comfortable pressure and just go back and forth or make some circles. And what we are doing right now is we are clearing the end of the line of the lymphatic system. This is where all the lymph that gets collected from the body, that's cleaned at the lymph nodes, this is where it dumps into the veins. This is called the supraclavicular fossa, and this is where the blood pressure is lowest, so that the lymph won't reflux back from the veins into the lymphatic system. And I don't know about you guys, but I have really tight neck muscles. And I think that that can affect some of that circulation there. So this is a good reminder to all of us just to kind of pause for a moment and let ourselves relax. So after a couple of minutes of this, what I'd like you to do next is to put your hands over your belly button. And I want you to take a nice deep breath, either through your mouth or your nose, and then exhale completely. And if you're pushing out every bit of air, what you'll notice is when you take the next breath, you'll breathe in a little bit more deeply. Now, the reason I had you put your hand on top of your belly button is because ideally, if you're breathing using your diaphragm muscles, it's going to move your abdomen in and out. So when you breathe in, you can feel your hand being pushed out by the breath. And as you breathe out, you can feel your hand sink in towards your belly. Diaphragmatic breathing, if I taught only one thing, that's what I would teach, because the lymph system does not have a central pump like the heart and the circulatory system. So the diaphragm is about as good as it gets. And there's been a lot of research that has shown that when people start doing more deep diaphragmatic breathing, and keep going, keep breathing, just because I'm talking doesn't mean I want you to stop, because the more you can breathe from your diaphragm, the better your lymphatic circulation will be. It helps throughout the entire body. And for those of you who have lower body lymphedema, the diaphragm almost creates, I would say, like a wicking action to help that fluid move against gravity up where it can reach the nodes and become cleaned and then go through its cycle. So those are the first two steps. Now the next steps are stimulating the regional lymph nodes. When I say regional lymph nodes, I mean the nodes that are responsible for taking care of all of the lymph fluid in that part of the body. So if you can imagine the body, first off, we're going to divide it at the head. So we're going to start up here at the neck. Go ahead and just kind of give yourself a nice little neck massage, because these lymph nodes drain the face, the entire head, the brain. So these are very, very important. Plus, it just feels good to kind of give yourself a little massage like this. So after a couple of minutes, we're going to move down, and the axillary lymph nodes are located in the armpits. And you can do one at a time. You can do the funky chicken, do both at the same time. There's all sorts of ways to do it. But even if you just do one side at a time, this is going to help to rev up and stimulate those lymph nodes so that they can do their job better. What are the function of the lymph nodes? It's to filter the lymph fluid and to clean it. What is the lymph fluid? It's the garbage system of the body. It's all the bacteria and viruses, all of the dead cells, and even cancer. So we really need our lymph systems to be moving properly so that we don't get all this garbage stuck. All right, so the last group of lymph nodes are in the groin. So if you place your hand in the crease when you're sitting in between your hip and your pelvis, that is the inguinal area. And it's a little hard for me to show you on camera, but if you can just do some gentle circles in that area, what I tell people is put your hands on your hip bones and aim your fingers towards your pubic bone, and you'll be right in that angle. So those are the 3 sets of regional lymph nodes. And I'm going to add one more thing. And these are the deep abdominal lymph nodes. Now, the diaphragm helps to stimulate those, but you can also place your hands on your tummy. And I tell people it's almost like you're kneading bread. You want to just gently go back and forth. And this helps to mobilize the lymph nodes around our digestion, because the digestive system has the most lymph nodes of any other place in the body. So that's it.
I love that. Thank you. I feel like I could take a nap now. After that, I could just listen to your voice and do MLD, and I get so sleepy. That's wonderful. Thank you. I hope everybody in the audience is also feeling nice and moved. We're seeing some thank you so muches. So we really love that, Karen. Thank you. That was really lovely.
Let's do it again sometime.
Yes, we could do it again next month.